any patient that's a patient of ours, we always provide and make them mouth guards and complimentary, because to us it's just really important that our patients protect their teeth. So that can be anyone from they're involved in a sport locally to I've made some guards for adults that are weightlifters, and when they're working out they just find themselves clenching their teeth. We'll make them for them. So those are two areas that the sport guards are really useful. Something that people don't consider a lot though, and they're not really a sport guard, but in essence they are, is that we've really tried to reach out and inform our patients, make them aware of that. Sometimes we've had cases where patients are diagnosed with cancer, especially if it's from the neck up. A lot of times that involves radiation. And what's really important is that we make them guards and we'll work in conjunction with the physician, and those guards will actually help protect their teeth and gums during the radiation treatment. And also then we'll make them a separate set of guards that isn't really a guard, it's more like a fluoride tray. Similar materials, just a little thinner, where they actually can apply fluoride, which decreases the potential side effects or bad effects that they're going to suffer as a result of the radiation, having their salivary glands and everything in their mouth. They develop what's called dry mouth. And unfortunately, when people aren't aware of that, it can be really a problem when all of a sudden someone who hasn't had decay for a century, or not a century, but a decade, will show up and all of a sudden they have 10 cavities. And it's a result of the radiation. Not the radiation directly, but a side effect of the radiation drying their mouth out. So we just recently had a case where we actually for the last few years we've made the sport guards for the lacrosse team at our local high school, and we just recently got a letter from a mom, and they weren't patients of ours, because we don't, it's not like you have to be a patient to come in and have it made. We just make them for you. And she just said basically a thank you to us that her daughter had been hit in the mouth with one of the lacrosse sticks and cut her lip up pretty bad, but she had her mouth guard in. And so they pretty much told her that if she had not had her mouth guard in, she would have, at the minimum, cracked her front two teeth, if not knocked one or two of them out, or had them knocked out. So those are the kind of things, when you hear those things, that's makes it worth it to be able to provide those services for existing patients and also for the local sports teams.